Hello, my name is Chad Dotson, and my topic is parasitic diseases in Brazil. Brazil, formerly known as the Federative Republic of Brazil, is by far the largest, most populous country in Latin America. It is a country of great diversity and is Latin America's leading economic power and a regional leader. However, high rates of political corruption and unequal income distribution, though improving, remains a pressing problem leading to high crime rates and social and economic disparities. Although Brazil has a substantial and diverse middle class, large social gaps exist between the small, privileged upper class and the masses at the bottom of the earning scale. Healthcare in Brazil is provided by both private and government institutions. Public healthcare is provided through the National Healthcare System, known as the Unified Health System, and is universal and free for everyone. Numerous state and national agencies operate a variety of healthcare services, although often with limited programs. Roughly four-fifths of the hospitals in Brazil are public institutions. They usually serve poor Brazilians and have been criticized for responding slowly to emergencies and delay in treatment. Although most tropical diseases have been eradicated in the major cities, migrants from infected areas have reintroduced some diseases. Poor sanitary and housing conditions worsen these health risks. Brazil has overcome more than 2 decades of military intervention to pursue democratic rule. Today, Brazil is a federal republic divided into 26 states and the federal district. The legislative branch consists of the bicameral National Congress, which is comprised of the Chamber of Deputies and the Federal Senate. Executive power is exercised by the President, who is the head of state and government, and directly elected to a 4-year term. The Brazilian judicial system is divided into two branches: the ordinary branch, which consists of the state and federal courts, and the special branch, which consists of labor, electoral, and military courts. The climate of Brazil comprises a wide range of weather conditions across a large area, but most of the country is tropical. The different climatic conditions produce environments ranging from equatorial rainforests in the north to temperate coniferous forests in the south. Brazil also has a diverse topography, ranging from hills and mountains to plains and wetlands. Climate plays a major role in the occurrence of parasitic infection and can influence all stages of a parasite's life cycle. Warmer temperatures are believed to shorten the duration of the growth cycle and favor the replication of pathogenic agents. Brazil lacks a cold season, which controls the insect population by forcing hibernation. That and heavy rainfall directly affect the formation of breeding grounds for insects. Insects, such as mosquitoes and flies, are by far the most common disease carriers, or vectors. These insects may carry a parasite, bacterium, or virus that is infectious to humans. Most often, disease is transmitted by an insect bite, which causes transmission of the infectious agent through blood exchange. The most common parasitic diseases in Brazil are malaria, leishmaniasis, and American trypanosomiasis. Leishmaniasis is found in the tropic and subtropic regions of Brazil. It is classified as a neglected tropical disease. Neglected tropical diseases, or NTDs, carry a social stigma due to their disfiguring, debilitating, and deadly impact. They are found in the poorest, most marginalized communities or conflict areas. The increase of leishmaniasis infection has caused social and economic burden and has resulted in the delay of development programs in Brazil. Leishmaniasis is caused by protozoan parasites from the genus Leishmania. The vector is the phlebotomine sandfly. There are three forms of leishmaniasis: cutaneous, visceral, and mucosal. Cutaneous leishmaniasis is the most common form, with 73,000 to 120,000 cases reported annually. This form causes skin sores, which can occur within a few weeks or months of the sandfly bite. The sores can change over time, starting from a bump or a lump and progressing to an ulcer. They are usually painless, but can also be painful. Visceral leishmaniasis affects several internal organs, including the spleen, the liver, and bone marrow, and can be life-threatening. Symptoms such as fever, weight loss, and enlarged spleen and liver typically develop within months of a sandfly bite. Mucosal leishmaniasis is less common and can be caused by species that cause cutaneous leishmaniasis. Parasites spread from the skin and cause sores in the mucous membranes of the nose, mouth, and throat. Leishmaniasis is transmitted by the bite of infected female phlebotomine sandflies. The sandflies inject promastigotes from their proboscis during blood meals. Promastigotes that reach the puncture wound are phagocytized by macrophages, where they transform into amastigotes, which multiply by simple division and infect other phagocytic cells. Sandflies become infected by ingesting infected cells during blood meals. In sandflies, amastigotes transform into promastigotes, develop in the gut, and migrate to the proboscis. Pentamidine is an aromatic diamidine used in the treatment of leishmaniasis. It binds to the tRNA and inhibits amino acylation and translation. Pentamidine can cause allergic and toxic side effects, most commonly having effects on the pancreas. American trypanosomiasis, also known as Chungus disease, is classified as a neglected parasitic infection. It is caused by the protozoan Trypanosoma cruzi, and the vector is the triatomine bug. An infected triatomine bug takes a blood meal and releases trypomastigotes in its feces near the site of the bite wound. Trypomastigotes enter the wound, invade cells near the site, and differentiate into amastigotes. The amastigotes multiply, differentiate into trypomastigotes, and enter the bloodstream, where they infect a variety of tissues and triatomine bugs become infected by feeding on blood containing the parasite. The ingested trypomastigote transform into epimastigotes in the vector's midgut. Here, parasites multiply and differentiate. In the hindgut, it differentiates into infective metacyclic trypomastigotes. The acute phase lasts a few weeks or months after infection and can be mild or asymptomatic. At this stage, the parasite can be found circulating in the blood. Although rare, inflammation of the heart and brain are possible. The chronic phase is characterized as being prolonged and asymptomatic. At this stage, few or no parasites are in the blood. An individual may be asymptomatic for life. However, 20 to 30% develop life-threatening or debilitating symptoms. Symptoms include heart rhythm abnormalities that can cause sudden death, a dilated heart that doesn't pump blood well, or a dilated esophagus or colon. In Brazil, American trypanosomiasis is commonly treated with benznidazole. Its mechanism of action is the production of free radicals, facilitated by the enzyme nitroreductase 2. The parasite is sensitive to these free radicals given its reduced detoxification capabilities. Benznidazole is most successful during the acute phase of the disease, with a success rate of 80%. However, it is limited in curing the disease during the chronic phase. The most common side effects are insomnia, weight loss, and allergic dermatitis. In Brazil, malaria is caused by the parasite Plasmodium vivax and Plasmodium falciparum. The vector for this disease is the Anopheles mosquito. Although the Anopheles mosquito is located in 80% of the country, 99.8% of the cases are reported in the Amazon region. This is due to deforestation, resettlement, and agriculture. The malaria parasite life cycle involves two hosts. During a blood meal, a malaria-infected female Anopheles mosquito inoculates sporozoites into the human host, which infect liver cells, mature, rupture, and release merozoites. After this initial replication in the liver, the parasites undergo asexual reproduction in the erythrocytes. The ring stage trophozoites mature and rupture, releasing merozoites. The gametocytes are ingested by a mosquito during a blood meal. The parasite's reproduction in the mosquito is known as the sporogenic cycle. While in the mosquito's stomach, the microgametes penetrate the macrogametes, generating zygotes. The zygotes in turn become motile and elongate, which invade the midgut wall of the mosquito, where they develop into oocytes. The oocytes grow, rupture, and release sporozoites, which make their way to the mosquito's salivary glands. Inoculation of the sporozoites into a new human host perpetuates the malarial life cycle. Malaria disease can be categorized as uncomplicated or severe. In general, malaria is a curable disease if diagnosed and treated promptly and correctly. Uncomplicated malaria is characterized by a cold stage, a hot stage consisting of fever, headaches, or vomiting, and finally a sweating stage consisting of sweats and a return to normal temperature and tiredness. Severe malaria is characterized by many symptoms, including organ failure, abnormalities in the blood and metabolism, anemia, and acute respiratory distress syndrome. Doxycycline is used to treat malaria. It is a tetracycline which inhibits apicoplas gene expression, which is necessary for proper cell division. Due to its mechanism of action, there is a delayed effect. It is often used with other fast-acting drugs to treat malaria.